Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
It's really amazing how much research is being done these days into type 2 diabetes.
It is.
It seems like every day there's something new to learn.
Yeah.
And speaking of new, you've sent us some interesting info about a potential new oral treatment.
I have. For type 2.
Yeah. This one is really interesting.
Yeah.
It's called Berberine ursodeoxycholic.
Wow.
It's kind of a mouthful.
It is a mouthful.
But it's showing some promising results in early trials.
Right. And it's so important for people with type 2 diabetes to have options.
Absolutely.
Because managing blood sugar and all the related health issues can be a real struggle.
Oh, yeah, for sure.
So let's dive into what we've got here.
Okay.
We have a news article from Medical Express.
Okay.
And the actual research paper from JAMA Network Open.
Awesome.
So first, what exactly is this berberine ursodeoxycholic?
Okay.
And why is it generating buzz?
Well, it's a combination of two compounds that each have a history of medicinal use. Berberine.
And ursodeoxycholic acid.
Wow, those are big words.
They are big words.
Yeah.
But berberine is known for its potential to help balance glucose and lipids.
Okay.
And ursodeoxycholic acid is often used for its liver protective properties.
Interesting.
But what's really interesting is that together, they seem to work synergistically, creating what the researchers are calling a gut-liver anti-inflammatory metabolic modulator.
Okay, that sounds impressive. But break it down for our listener.
Sure.
What does that actually mean in plain English?
Essentially, this combination targets both the gut and the liver, which are key players in how our bodies process food, regulate blood sugar, and control inflammation.
Okay.
So by working on both fronts, berberine ursodeoxycholic aims to address those underlying metabolic imbalances that drive type 2 diabetes.
So it's not just about masking symptoms.
Right.
It's about getting to the root of the problem.
Exactly.
That's exciting.
It is exciting.
Now, this research we're looking at focuses on a phase 2 clinical trial conducted in China.
Yes.
What can you tell us about the study itself?
So this trial involved 113 patients with type 2 diabetes who weren't adequately managing their condition with diet and exercise alone.
Right.
It was a double-blind, placebo-controlled study, which means that neither the patients nor the researchers knew who was receiving the actual treatment versus a placebo.
Got it.
And that's really the gold standard for this type of research because it eliminates bias and helps ensure that the results are reliable.
Makes sense.
Yeah.
So what did they find?
Okay.
Did this combination therapy actually live up to its potential?
So the results were really encouraging.
Okay.
The patients were divided into 3 groups.
Okay.
A placebo group, a low-dose group receiving 500 milligrams of berberine ursodeoxycholic twice daily, and a high-dose group receiving 1,000 milligrams twice daily.
Wow. Okay.
So the trial lasted for 12 weeks. And over that time, the researchers closely monitored various indicators of metabolic health.
All right, so give us some of the key findings.
All right, so first and foremost, the treatment significantly improved blood sugar control.
That's great.
Especially in the high-dose group.
Okay.
Their hemoglobin A1C levels, that's a measure of long-term blood sugar control, dropped significantly more than in the placebo group.
So that's really good news.
Yes, very good news. In fact, more participants in that high-dose group achieved target blood sugar levels below 7%.
Wow.
Which is a big deal for managing diabetes effectively and preventing complications.
Absolutely. That's fantastic.
It is.
But the benefits didn't stop there.
Right.
The news article mentions something about improvements in heart and liver health as well.
Yes, that's right.
So tell us about that.
The research also showed positive effects on what are called cardiometabolic risk factors. So, for example, participants taking berberine ursodeoxycholic saw improvements in their cholesterol levels. Specifically, the bad cholesterol known as low-density lipoprotein and non-high-density lipoprotein, as well as triglycerides, another type of fat found in the blood.
So it's hitting multiple targets at once.
It is.
Which is what makes this so exciting.
Exactly.
And how about liver health?
Okay.
What did the researchers observe there?
So the study found that participants taking berberine ursodeoxycholic
Yeah.
also experienced improvements in their liver enzyme levels.
Okay.
This suggests that the treatment may have a protective effect on the liver,
Interesting.
which is particularly important for people with type 2 diabetes as they are at increased risk for liver complications.
Right. Makes sense.
Yeah,
This is all sounding very promising, but of course safety is always a concern when it comes to new treatments.
of course.
What can you tell us about the safety profile of berberine ursodeoxycholic?
So one of the most encouraging aspects of this trial is that the treatment was generally well tolerated.
That's good.
Over 97% of the participants completed the study,
Wow.
and there were no discontinuations due to adverse events.
That's great.
There were some mild side effects reported,
Okay.
such as slightly elevated levels of fats in the blood,
Uh-huh.
but nothing serious.
Okay, that's reassuring to hear,
Yeah,
especially because some diabetes medications can have side effects that make people reluctant to take them.
absolutely.
Were there any other safety findings that stood out to you?
Yeah, so importantly, no one experienced dangerously low blood sugar,
Okay.
which is always a concern with diabetes medication.
Right.
And unlike some medications that can cause weight gain,
Right.
body weight remains stable across all the groups in the study.
Those are all really important points for people living with diabetes who have to be so mindful of how medications might affect their overall health.
Yes.
Now, the article we have also includes a commentary by a diabetes expert named Nestoras Mathiadakis.
Okay.
What were his thoughts on these findings?
So Mathiadakis was impressed with the results, particularly the improvements in both blood sugar control and cardiometabolic risk factors.
Mhm.
He pointed out that while the glucose-lowering effect of berberine ursodeoxycholic was slightly less potent than metformin,
Okay.
a commonly prescribed diabetes drug,
Right.
it was still comparable to other FDA-approved medications.
Interesting.
Yeah.
And he also highlighted some potential advantages that berberine ursodeoxycholic might have over metformin, right?
He did, yes.
Tell me about that.
He suggested that this new treatment might cause fewer gastrointestinal side effects,
Okay.
which can be a real issue for some people taking metformin.
Yeah, the big one.
It is a big one.
Yeah.
He also pointed out that it could potentially be safer for individuals with kidney or liver issues,
Right.
which is really important as those conditions often coexist with diabetes.
Absolutely.
Yeah.
And I found it interesting that he also brought up the fact that many people prefer natural therapies.
Yes.
You know, if they feel good about what they're taking, they're more likely to stick with their treatment plan.
Absolutely. That's a great point.
Right.
Yeah, the psychological aspect of treatment can be just as important as the physiological effects.
For sure.
Feeling confident and comfortable with your medication can make a big difference in how well you manage your condition.
Absolutely. Now, before we get too carried away with the excitement of a potential new treatment,
Yes.
it's crucial to acknowledge that every study has its limitations.
Of course.
What are some of the things we need to keep in mind when interpreting these findings?
You're absolutely right. We always need to be cautious and not jump to conclusions based on one study.
Right.
One of the main limitations here is that the trial only lasted for 12 weeks. We need longer-term studies to really understand how this treatment performs over time
Right.
and to assess its long-term safety.
Okay, so longer studies are needed.
Longer studies are needed, yes. And it's important to note that the participants in the study were all from China, so we need to see how this treatment works in more diverse populations.
Right. Different ethnic groups can respond to medications in different ways.
They do.
So it's crucial to ensure that the benefits and safety profile hold true across various genetic backgrounds and lifestyles.
Exactly. Those are really important considerations for future research.
Yeah.
It would also be beneficial to see how this treatment compares head-to-head with existing diabetes medications in larger, more diverse groups of people.
I'm curious about something.
Okay.
The research paper mentions that berberine ursodeoxycholic works on a molecular level
Yes.
by activating something called AMP kinase.
Right.
And inhibiting the NLRP3 inflammasome.
Yes.
Can you explain what those are and why they matter?
Sure. So AMP kinase is an enzyme that plays a crucial role in how our bodies use energy.
Okay.
Activating AMP kinase helps our cells utilize glucose and fatty acids more efficiently.
So it's like flipping a switch that tells our bodies to use fuel more effectively.
That's a great way to put it.
Okay.
Now, the NLRP3 inflammasome is a complex that's involved in the inflammatory response.
Okay.
Inhibiting the NLRP3 inflammasome helps reduce the chronic inflammation that's often present in people with type 2 diabetes.
Okay, so it's like turning down the volume on the inflammatory signals that contribute to the disease.
Exactly.
It's fascinating to see how this treatment is working on multiple levels to address the underlying causes of diabetes.
It is.
And speaking of addressing underlying causes, one of the things that really struck me about this research is the focus on liver health.
Absolutely. Liver diseases of metabolic origin, like non-alcoholic fatty liver disease,
Right.
often go hand in hand with type 2 diabetes.
Yeah.
And the fact that this treatment shows promise for improving liver function is a big deal.
It's like a 2-for-1 benefit,
Yeah.
addressing both diabetes and liver health simultaneously.
Right.
The study found that even people with relatively mild liver disease saw improvements in their liver enzyme levels,
They did.
which could have huge implications for preventing more serious liver complications down the road.
It could, for sure.
Yeah.
It's about being proactive and addressing those interconnected health issues early on.
Now, we've talked about the potential benefits of this treatment,
Yes.
but I want to circle back to those limitations we discussed earlier.
Okay.
The short duration of the trial, only 12 weeks, is a key consideration.
It is.
Why is that such a big deal?
Well, while 12 weeks is a good starting point,
Uh-huh.
it's not long enough to tell us how this treatment will perform over the long term.
Right.
We need studies that last for months, even years,
Okay.
to truly understand its long-term effects and safety profile.
That makes sense. And those longer-term studies would also allow researchers to compare this treatment head-to-head with other diabetes medications.
Right.
For example, the research paper mentions that its effect on blood sugar was slightly less potent than metformin in the short term. But how does it stack up over time?
Exactly. And does it offer benefits that other medications don't? Those are questions that future research needs to answer.
Right.
It's all about finding the right treatment for each individual based on their specific needs and health history.
And the lack of diversity in the study population is another crucial limitation.
It is.
We need to see how this treatment works in other ethnic groups to confirm that it's effective and safe for everyone.
For sure.
Are there any plans to address these limitations in future research?
Yes. Thankfully, the article mentions that phase 3 clinical trials are already underway.
That's good news.
It is good news.
Yeah.
These trials will enroll more participants from a wider range of locations
Okay.
and will run for a longer duration.
Great.
This will give us a much clearer picture of this treatment's true potential.
That's really encouraging to hear. It sounds like these phase 3 trials are going to be exciting to follow.
I think so.
They'll provide invaluable data that can help inform treatment decisions for people with type 2 diabetes.
Yes.
And potentially lead to even more personalized approaches to care.
Absolutely.
But one of the things that I find most fascinating about this research is what it tells us about the future of diabetes care more broadly.
I agree. I think this study highlights a really important shift in how we think about treating diabetes. It's moving beyond simply managing blood sugar levels to tackling the underlying metabolic disturbances that drive the disease.
It's about looking at the whole picture,
Yes.
understanding the interconnectedness of different body systems,
Yes.
and finding ways to restore balance
Yes.
rather than just suppressing symptoms.
Right.
It's a more holistic approach, which I think is really exciting.
Absolutely. And this approach has the potential to not only improve diabetes management,
Mm-hmm.
but also prevent or delay the development of other chronic conditions that often accompany diabetes, like heart disease and liver disease.
It feels like we're on the cusp of a real paradigm shift in how we approach not just diabetes, but chronic disease in general.
I think you're right. This move towards understanding the underlying mechanisms, those shared pathways that connect seemingly disparate conditions, is incredibly promising.
And this research on Berberine ursodeoxycholic really exemplifies that shift. It's not just about lowering blood sugar.
Right.
It's about addressing those deeper metabolic imbalances that contribute to so many health problems.
Precisely by targeting both the gut and the liver.
Yeah.
This treatment is getting at the heart of metabolic health. And remember, those improvements in cholesterol levels and liver enzymes we talked about, those are all pieces of the same puzzle.
It's amazing to think that a single treatment could have such a wide-ranging impact.
It is.
And the fact that it's a combination of naturally derived compounds is also really intriguing. It speaks to this growing interest in finding solutions that work in harmony with our bodies.
Absolutely. And this ties back to something that Nestor's Mathiadakis mentioned in his commentary.
Right.
Patient preference.
Right.
People are becoming more discerning about the medications they take. And there's a real desire for treatments that align with a more holistic, natural approach.
I think that's a really positive development.
Yeah.
It means people are taking ownership of their health, doing their research,
They are.
and having those important conversations with their healthcare providers.
Absolutely. I couldn't agree more. It's about finding what works best for each individual, both physically and psychologically, and having a variety of options, including those derived from natural sources, empowers patients to make choices that feel right for them.
So as we wrap up this deep dive,
Yeah.
what are some key takeaways you'd like to leave our listener with?
Okay, well, first and foremost, I think it's important to remember that this research on berberine ursodeoxycholic is still in its early stages.
Right.
We need those larger, longer-term trials to confirm these findings and explore its full potential. But even at this stage, the results are incredibly encouraging.
Right. It's definitely something to watch closely and to discuss with your doctor if you're looking for new options to manage type 2 diabetes.
Exactly. And I think this research also serves as a reminder that we're living in a time of incredible scientific advancement. New discoveries are happening all the time.
Yeah.
And there's always hope for better, more effective treatments.
It's a message of hope and a call to action. Stay informed, stay curious, and stay engaged in your healthcare journey.
Beautifully said. This deep dive has given us a lot to think about, and I'm sure it sparked some questions for our listener as well.
Well, we've reached the end of our time for today, but the conversation certainly doesn't end here. We encourage you to explore this topic further. Talk to your healthcare providers and stay tuned for more exciting developments in the world of diabetes research.
Thank you for joining us on this fascinating exploration.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.